In this video, we're going to demonstrate vacuum dry cupping to the external hip rotators, focusing primarily around the tensor fasciae lata, gluteus minimus. We'll also add some cups to gluteus maximus, along with the wider hip area, including the iliotibial band. And when we do the sliding techniques, we'll also come into the quadriceps and the hamstrings also. So this is a really nice technique for increasing mobility around the wider hip area and also reducing pain and dysfunction around the gluteal and the lower back and hip region as well. So for the purposes of today, I'm going to use the lotion from Physique. However, you can use any medium that you already use within your clinic, such as oil, wax, or cream as well. I'm also using the vacuum cups. This is the Dong Bang 17-piece vacuum kit. And these are really nice because it's nice and easy to apply the cups and also to take the cups off afterwards. So we're going to start by preparing the client. So we need to make sure that the clothing is lifted right up over the greater trochanter area, because the greater trochanter is going to be that first landmark. Because we're doing some stretching techniques as well, we want to make sure that their clothing is nice and secure. So in this instance, Katie has got some nice stretchy shorts on here, which lift up over the greater trochanter. However, if you needed to within clinic, you could also add an additional towel to maintain your client's dignity by placing the extra towel in between the legs and securing it to the front and the back of their clothing as well. Okay. So first thing we need to do is to apply the medium. So in this instance, I'm going to apply more medium than I would do normally for my manual massage techniques. So it's quite nice and liberal with the application of the medium. Now the medium doesn't need to be fully absorbed by the tissue. So we just need that nice sheen and that nice covering. If your client is comfortable, we can leave them in this stacked position, or we can use the bolster and bring this front leg slightly forward into almost like a recovery position. Okay, that way when we are applying the cups, we can also easily come into the hamstrings and we can also easily come into the quadricep area as well. So as you apply that medium, make sure you're covered around the quadriceps and also around the hamstrings too. Then when you're ready, you're going to take your cups, and the first cup we're going to apply is over the greater trochanter. Now normally from this sideline position is easy to palpate. So it's that nice bony protrusion, the external aspect of the hip there. This is going to provide us with our landmark, because we know that the tensor fasciae lata, which is one of those hip abductors and external hip rotators, sits just above the greater trochanter and anterior of it as well. Okay, so from here, my next cup is going to go directly above the cup over the greater trochanter. So it's sort of on that tensor fasciae lata glute med border. Then from here, I'm going to come anterior with my cup onto TFL. Okay, then from here, we're aiming more for glute medius, coming posterior of that second cup. Okay, so these are going to be working statically to release some of that hip tension in that first instance. Then with an additional cup, we're going to come right into the middle of gluteus maximus. There's often a common trigger point and a common tension area in the middle of gluteus maximus, especially if yourself or your client has restricted mobility around the hip. So my next cup is going to go directly over that trigger point. And quite often, if the trigger point in gluteus maximus is a little bit active, we might have underlying tension in the piriformis as well. Now we know that the piriformis starts at the sacrum and it's broader at that sacrum area and gets smaller and thinner as it inserts onto the greater trochanter. So it's quite nice to add an additional cup in between that cup over the greater trochanter and also that cup over the gluteus maximus. Okay, once they're on, what we can do is ask the client how they're feeling and how that tension or that vacuum lift in the cups is feeling. Okay, we're keeping an eye on what's happening to the tissue within those cups as well. So we're keeping an eye on the colour. We don't want the colour to go too dark, sort of like a dark purplish colour. In those instances, if it starts to go dark purple, we would want to remove those cups because that would be enough of that vacuum lift in that instance. We know then that the vacuum has drawn the blood out of the muscle tissue into that interstitial space, and underneath that, fresh blood flow has come into the muscle tissue. Along with that, that would create a relaxation effect in the muscle tissue as well, reducing that muscle tension. So whilst these cups are working statically, what we're then going to do is we're going to work along that iliotibial band area. If we had lateral knee pain, for instance, because there might be a bit of tension in the iliotibial band, then there's going to be underlying tension sitting under the iliotibial band because the friction between that band and the vastus lateralis might create trigger points through that rubbing and through that friction. These static cups here, especially over tensor fasciae lata, glute min and glute max, are going to be helping to reduce any tension on the iliotibial band itself because these muscles come into the iliotibial band, but the band itself is thick fascia. It's not designed to be elastic. Okay, it's designed to transmit power from the hip towards the knee area and separate the compartments of the leg. So if we want to reduce friction on the IT band, then we need to work on the muscles that come into it. And these cups are doing that job at the moment. So as we're sliding up and down the iliotibial band, we're primarily trying to mobilize the tissue underneath it, which is the vastus lateralis. Okay, so whenever we slide, we always do our test with our finger and our thumb first. So I'm going to check that I've got some friction underneath that cup, okay, but I don't have to yank the cup to get it to start to move. If you have to yank it to get it to move, it's too tight. Okay, so in that instance, I'm going to slide up and down that iliotibial band. You'll find that it gets tougher to slide as you get nearer to the knee, as the band itself starts to insert onto the bone. Okay, so we can go longitudinal with that sliding, and we can also come transversely as well. So always check to see which one feels more comfortable. Okay, sometimes coming across the band transversely will feel more comfortable, and other times sliding up and down will be comfortable. If both feel fine, then go in both directions. Okay, then once we've been up and down that a few times, we can then slide around that wider area, such as the quadriceps here, and also into those hamstrings as well. So we're relieving tension through that cupping, sliding technique in the hamstrings, along the iliotibial band and quadriceps. And as we're doing that, we're also keeping an eye on the colour in these cups too. Okay, and just checking that they're creating that vacuum lift, which is going to create a stretch reflex in the muscle tissue, and also that they're increasing that localised blood flow. Then when you finish sliding, we're then just going to flush that area. A little bit of manual one-handed effleurage. Okay. Then from here, we could either take these cups off if they've reduced enough tension, depending on the colour, or we can go into a stretch technique. So in this instance, we're going to go into a stretch technique first before we take the cups off and slide around the wider gluteal region. Now, the first stretch technique that we're going to do is a gluteus maximus stretch by bringing the knee up towards the chest. But before we do that, we're going to add a couple of extra cups into the hamstring area, because we know when we bring the knee into the chest, that's going to stretch glute maximus, but it's also going to provide a bit of a stretch for the top of the hamstrings, because the hamstrings come in and insert onto the ischium. Okay, so I'm going to take 2 more of my standard size cups, okay, and I'm going to place them on the hamstrings just below that gluteus maximus cup. Okay, now from here, Katie is going to work actively. She's going to do the stretch herself by bringing her knee in towards her chest or up towards her chest. I'm just going to remove that bolster as she does that. And then she's going to come back to that start position. So we can guide them if we want to with the hand here, or just allow the client to do that movement herself. So she's going to do that 2 more times. So 3 movements in total. Excellent. And then from here, if that's produced enough of a relaxation effect, we could stop here, or we can combine those movements into a glute max stretch and into a hamstring stretch. So in this instance, Katie's now going to bring that knee up towards her chest. Okay, stretching gluteus maximus, and then she's going to extend the knee as well. Then she might not go into a straight position depending on how much tension is in the hamstrings. Then she's coming back to that start position. Excellent. And then again, knee into chest. So generally about 3 to 6 repetitions of these stretches, and then flexing that knee and back to that start position. Brilliant. And then one more time. So knee to chest, and then extending, and then flexing, and then back into that start position, relaxing that leg down. Excellent. So that will help to reduce tension for the stretching technique in gluteus maximus and the hamstring area. And if we wanted to, we could add a couple of extra cups further down the hamstring. But we've also got the cups on TFL and glute med, so we can also do a stretching technique to help to further reduce tension in that area as well. So in this instance, I'm going to get Katie into the clam position. So if you soften both of those knees, that's it. Bring those heels further towards the bottom. Brilliant. Okay, now from here, I'm just going to lift that towel in between those legs. Perfect. Okay, now generally for our soft tissue release techniques, we would normally apply the cups when the muscle is in a shortened and relaxed position. Now these cups didn't go on when the muscles were in the shortened and relaxed position, so it's going to work in a reverse way. So the first time that Katie lifts her knee into that clam stretch or that clam exercise, the muscles are going to find it harder to contract because they're already in a stretched position. Okay, so they'll find it difficult to create that full force through that muscular contraction. Then when the knee relaxes back down, then the muscle will relax. We know that after a muscle has contracted, it's easier to stretch the next time round. Okay, so then we might find over those repetitions, as we're releasing some of that muscular tension, that knee will come higher and higher. So it still will create a relaxation effect in the muscles, but this time it's through the muscle trying to relax enough so it can get a full contraction. Okay, so Katie, sometimes it's nice to hold the client on the hip here, because once they lift the knee to their full height, they quite often want to roll through the pelvis. So we're just going to help to stabilize the client here with the hand onto the hip. And we're going to ask Katie just to lift that knee up, keeping those ankles together. Perfect. And then relax back down again. And then again, second time, so lifting that leg, just working with the amount of movement that is possible. And again, lifting and just watching to see whether that height increases over time. And again, using this hand to stabilize them to make sure that they're not rolling back. And then one more time. Perfect. And back down. Excellent. And then you're getting feedback from your client to see whether that felt easier over those repetitions. Okay, so I'm now going to remove those cups. So with these long blankets, to remove the cups, I'm just moving that valve over to the side. Okay, and I'm going to keep one cup handy. So I'm going to take a little bit more medium here as we then just flush through that area with a little bit of effleurage. Then we're feeling, as we're doing a little bit of sweeping effleurage here, we're feeling for that change in the muscle tissue to see whether there's been a reduction in that tension. Okay, then we're just going to finish off with a little bit of sliding around this wider area. So this is really nice. So we can slide from the TFL, which often we've got a lot of tension in that hip flexor area just at the top. It's a common trigger point just at the top here. So this cup always feels really nice if that trigger point is active. Okay, so we're sliding from front basically over the top into glute medius, into glute maximus, and then gradually coming forwards and backwards from the front of the hip area over the glutes, and then working further down the leg. So it's a really nice sliding technique, moving from front to back of the leg. Okay, again, we can work transversely like I'm demonstrating here, or we can work longitudinally as well. Okay, so that was a demonstration of our static cupping techniques around those external hip rotators and hip abductors, including TFL, glute med, glute max, and also including the quadriceps and the hamstring area. So we did static cupping along with some sliding techniques and some stretching techniques. All of these techniques are great for reducing tension, increasing mobility, and reducing any associated pain or discomfort around that wider hip area.